Hi everyone. In today's video, we are going to be talking more about if brain scans and brain imaging can be helpful in diagnosing schizophrenia. So today I'm going to be joined by Dr. Tracey Marks again. Dr. Tracey Marks is a psychiatrist who practices in Atlanta, Georgia, and she also has her own YouTube channel, Dr. Tracey Marks, which we will link to in the description below. She has over 1 million subscribers and shares so much knowledge around psychiatry and mental health in general. All right, so hello, Dr. Marks. Thank you so much for being here again with us today on the channel. It's wonderful to have you again.
Yeah, I'm happy to be here.
In today's video, we are going to be talking more about brain scans and brain imaging and how they can be used in diagnosing schizophrenia. So I guess to start off with, can you just kind of give us an overview of what types of brain scans and imaging are out there?
Sure. There are lots of different types of brain scans, and you could kind of put them in two categories. The snapshots, so kind of like one slice in time picture of your brain, and then there's the functional imaging that shows brain activity. The snapshots would be things like a CT scan, which is computerized tomography. I think that's what the CT scan stands for. That doesn't really show a whole lot. So kind of you just put that off to the side, but I wanted to include that. An MRI, which is magnetic resonance imaging, gives a much greater detail of the brain anatomy. It is good for seeing just, again, a snapshot of your brain to look for tumors or even see things like thinning of gray matter, larger ventricles, things like that. The functional imaging includes things like functional MRI, SPECT scan, and that's SPECT. And then there is PET scan, PET. Both PET and SPECT are nuclear medicine type scans. So it just means that the type of like dye that they put in your vein to light up your brain and things is different than what you would have with the functional MRI, which is magnetic resonance scan. All of them are expensive. The functional imaging is much more expensive than the MRI, and MRI much more expensive than CT scan. But kind of that's the landscape or the scope of the kinds of scans that you would use for studying the brain.
Right. So I guess what differences, if any, can be observed in any of these scans in the brains of someone who, or in the brain of someone who has schizophrenia versus the brain of someone who doesn't?
Sure. So what we have seen in studies is that when you look at just the snapshot of the brain, so say the MRI, some of the differences that we see are thinning of gray matter. The gray matter of your brain is where the nerves are. So you've got your nerve cell bodies, and then you've got the, little, the nerve fibers. All of that is considered like the cortex of your brain. So with an MRI scan, we have seen with schizophrenia that people will have in certain parts of their brain have less gray matter. When you have less gray matter, the spaces in your brain called the ventricles become wider. So kind of an easy way to recognize the thinning gray matter in certain parts is to notice that these spaces are wider than they should otherwise be for someone's given age. With the functional studies, you can actually see brain activity. So we see that in certain parts of the brain, it gets kind of complicated which parts of the brain are affected, but just suffice it to say that certain parts of the brain light up differently, showing decreased activity in people with schizophrenia. One area in particular is the frontal lobes. There's a lot that goes on in the frontal lobes. Executive functioning is one thing that happens with your frontal lobes, which is like planning, foresight, even being time management, thought organization, all of that. So you can imagine then if you have less nerve cells in that area or less connection between nerve cells in that area and thinning, that you'd have impairment or problems in that area, which is where some of the cognitive deficits that come along with schizophrenia happen or derived from. It's kind of the thinning or less nerve cells in those areas of the brain.
Right. So does this kind of degeneration, I guess, if you can call it that, that you see in these images or imaging scans, does that happen like throughout the illness and it becomes more pronounced? Or why aren't we using this to diagnose schizophrenia?
Yeah. So the first question of does it become more pronounced? So yes, it can become more pronounced over time. It's thought to even start that these brain changes are thought to start even before birth. Now, no one's going and trying to do, a scan on a woman's belly to look at an embryo in utero, but still, that's what it's thought is. It even starts before birth and then
Right.
can progress throughout the illness. It's variable as to how quickly things can progress, and you can even see this clinically with the illness. Some people's trajectory will be that, the typical trajectory is, I call it like you have plateaus. So you can function at a certain level for a while and then have a drop. And then now you're at that level for a while and then maybe another drop versus just kind of this steady decline over time. That can be
Right.
someone's trajectory, but often it's kind of more stepwise. The time between those drops can vary. It can be, maybe a year or two for one person versus a decade for another person. So the corollary to that is that you can have these brain changes that, again, your brain may stay the same for a long time. And then, then you have some more degeneration, if you will. And then, if you were to take another scan at a later point in time, you see the differences in the activity in the brain. Why wouldn't we do this to just diagnose anyone with schizophrenia, or to come up with the diagnosis or validate the diagnosis of schizophrenia? It's expensive, number one. These scans are very expensive, thousands of dollars. And then also, these changes aren't specific enough to say that if we see this, it means you have schizophrenia. For an example, I mentioned that as you can get thinning areas of the brain, you can get bigger ventricles or the spaces in your brain. Well, there's other disorders that can cause larger ventricle size. You can see that with different forms of dementia, for example. We also know that with depression, that your hippocampus in your brain shrinks. So, so because there isn't this one specific change that you can get with schizophrenia, that makes it clear that that's the only disorder where that happens, we can't really use those scans that specifically like that.
Right, that makes sense. So there are differences that can be observed in these scans, but they're not really conclusive in terms of being able to determine that there is a result of schizophrenia.
Correct.
So there is emerging evidence coming out that brain scans are being used to determine the most effective medication in the treatment of schizophrenia for people. And so do you know anything about this, or can you tell us a little bit more about this?
I know a little about it, and it goes back to using the functional scans. So the functional scans, like SPECT and PET, and they may even be using it with functional MRIs as well. They use glucose or sugar, and you can see differences in the uptake in the brain regions when that's kind of how they detect it on these functional scans. So you could give someone a medication and then do a functional scan to see what's going on in the brain, where there is activity or where there's uptake and things like that. So you can get a better sense that way of what effect the medication is actually having. Did it improve? So let's say someone starts out with a baseline scan that shows that they have less uptake in the left part of the brain. where the person with schizophrenia, they have less uptake, but then the person without schizophrenia doesn't. So we know that that's a problem, that that person has less uptake. This is hypothetical. Then you give them the medication, and then you do another scan, functional scan, and you see that, oh, now that area that had the deficit now has more uptake. Yay, that's what we wanted, because that's what a that's what a normal, you want to call it that, brain would look like. So that's the logic behind it, or that's the science behind how that would work. Again, we're kind of back to this. How specific is that process? Is it reliable across all scenarios? Because different people process medications differently. So if
Right.
I have a slow response to this medication, but ultimately it still helps me, what if it's just that it doesn't show up, that uptake change just doesn't show up on the brain scan, but it's really the uptake is corresponding to a different place on the brain scan. So I think, again, we're just at the point where we're too early in the process of studying this to know for sure that that's the way to go. And then it's worth the investment to have everyone get these functional brain scans to validate that a medication worked.
Right. That makes sense that we're not quite there yet for this to be implemented in common practice yet. So thank you so much, Dr. Marks, for sharing your knowledge and expertise around brain scans and imaging with us as well. It was really great. I learned a lot. So thank you so much for being here with us today.
You're welcome.
So a really big thank you again to Dr. Tracey Marks for being with us today to talk about brain scans and brain imaging and how they can be used or not used yet in terms of diagnosing schizophrenia. I learned a lot, and I really appreciated her sharing her knowledge and expertise with us. Again, make sure to check out Dr. Tracey Marks' YouTube channel as well. We will link to it in the description below. She has lots of really great information there, and I know I learn a lot from her videos too. Also, just a reminder that if you would like to help support us in creating content like this, to please make sure to check out the link to our Patreon page where you can support us in doing so. Through Patreon, you also gain access to our online peer support community where we offer various types of peer support, including facilitated weekly peer support groups. If this is something that interests you, or if you just want to help us in creating this type of content, please make sure to check out the link to our Patreon page. Thank you so much again for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.